Hi, I'm Dr. Mike DiTolla, and I'd like to welcome you to the 5-Minute Challenge. Today's episode is sponsored by Artistic Dental Laboratory in Bolingbrook, Illinois. Today's challenge, modern crown and bridge materials in 5 minutes or less. Tara, start the clock! I'm guessing all dentists are well aware of the benefits of cast gold, so I'm going to skip that and start with the invention of the PFM in 1959. The PFM was the crown and bridge workhorse for decades after its introduction and was the most prescribed restoration in dental laboratories until the beginning of its slow decline in 2010. There are still times when PFMs can be the restoration of choice. For me, an example of that is using a PFM bridge to replace a lower first molar when a single tooth implant won't be done, can't be done, or if there's not enough vertical clearance to ensure that a solid zirconia bridge will have a thick enough connector between the abutment and the pontic. For example, on a solid zirconia bridge to replace a lower molar, the connector needs to be 3 millimeters thick vertically, which often isn't possible due to super eruption of the opposing tooth, so unless you prepare the opposing tooth for a crown as well, a PFM bridge is often a better choice because you only need 1 millimeter of vertical thickness on a metal connector. Lucite-containing ceramics, such as Empress 1, were introduced in the late 1980s and were the first pressable ceramic materials. These materials became popular when dentists learned how to do veneers, and because lucite ceramic was both aesthetic and easy to use in the lab. Despite the increase in strength of lucite-reinforced pressed ceramics, fractures were still possible if bonding protocol wasn't properly followed or occlusal interferences weren't addressed, or if the preps were underprepared, especially when those preps were on posterior teeth. The introduction of CAD/CAM technology into the laboratory in the early 2000s spurred a whole new generation of ceramic substructures consisting of yttria-stabilized zirconia oxide, the same type of zirconia we use today, but back then zirconia was only used as a substructure and still needed to have a veneering ceramic. So while porcelain-fused to zirconia crowns were an aesthetic improvement to porcelain-fused to metal crowns, they both required a deeper preparation, and despite their strong substructures, both had weaker feldspathic ceramic as their veneering layer. After a couple of false starts as a substructure material, lithium disilicate reemerged in 2007 as IPS eMax from Ivoclar Vivadent. eMax was introduced as a pressable ingot for lab use, and while being nearly as aesthetic as IPS Empress, its flexural strength was 3 times as strong. After many years of eMax being the only lithium disilicate material available to dentists, in 2017 GC America introduced LiSi Press. LiSi is spelled L-I-S-I, and as you may have guessed, it's short for lithium disilicate. And LiSi Press can be used as a monolithic material, it can be cut back and layered, and it's appropriate for inlays, onlays, veneers, and crowns. The majority of restorations fabricated today are solid zirconia. And when Bruxer was launched in 2009, it was most dentists' introduction to the world of zirconia oxide restorations. The original Bruxer material is a 3Y material, which refers to the amount of yttria oxide that has been added to the zirconia. 3Y zirconias have the least amount of yttria added to them, which means that they're the class of zirconia that has the highest strength but the lowest translucency. Since 3Y materials are the strongest version of zirconia oxide, this makes them a particularly good choice for posterior restorations, especially on a patient who has previously fractured a PFM restoration. 3Y materials can be used anywhere in the mouth when needed. For example, we've all had patients who have worn down their natural teeth to almost nothing and now needs a crown. For these types of parafunctional cases, nothing tolerates this as well as full-strength zirconia. Zirconia is available in a 4Y and a 5Y formulation as well, and as you might expect, the 4Y and 5Y have more yttria in them than the 3Y formulation. The 5Y class of zirconia has the most yttria in its formulation and therefore has the most cubic zirconia content and is thus the most translucent of the zirconia classes, but alas, it is also the weakest. These 5Y or aesthetic zirconias are entirely appropriate for the anterior, where the biting forces are far less than in the posterior. But these 5Y materials do have enough of a strength drop-off for me not to use them in the posterior. And today's 3Y materials are aesthetic enough to be used on molars without patients objecting. So why not just use 3Y materials everywhere in the mouth? That's more strength than we really need in the anterior, and the 5Y materials are definitely more aesthetic. Tara! Whoa, stop the clock! A big thank you to today's sponsor, Artistic Dental Laboratory. Artistic are the dental material experts so that you don't have to be. Honestly, you shouldn't have to worry about which brand of zirconia oxide or lithium disilicate, or even which PFM to prescribe. You can trust Artistic to choose the best looking, longest lasting restoration for your specific clinical situation. Owned and operated by the same dental family since 1981, Artistic is one of only 3 Dawson Academy certified labs in the world. As a full-service laboratory, they can bring this level of attention to everything from your single-unit zirconia crowns to flexible partials to full-arch zirconia implant cases to complete smile makeovers. Check them out at artisticdl.com. I'm Dr. Mike DiTolla, and we'll see you on the next 5-Minute Challenge.